So Dyan's oxygen stats have just hit 90%, around about 91%, heart rate 74. She has just been given one single spray of GTN, the nitrolingual spray. It's 4:02 p.m. Her temperature is 37.7 degrees, so we actually are febrile at the moment. So that's her oxygen stats just dropping below 90%, 88%, as you can see. Now, she has had her lunchtime medication, so let's double check to see that they have actually all been taken. Hello, Di.
Oh, a bit spicy.
I'm not surprised you're not getting enough oxygen flow.
Bag of joy.
A bag of joy.
Are you taking my bag of joy away from me?
Yep, also taking your neck brace away from you so it doesn't impede airflow in case we have to do anything.
Bag of joy.
Bag
Goodbye.
of joy.
Need some mine.
You're not going to share. Oxygen stats at 92%, heart rate is 68.
Oh my gosh.
Right, so you didn't have the Panadol for lunchtime.
Oh.
Right. That's not working for me. Sweetie,
Yeah.
you're going pre-syncope because you're not getting enough blood flow and oxygen flow happening.
Oh, my bag of joy.
I want to take your bag of joy most likely.
That's right, please.
Okay. Why did you not take the Panadol lunchtime?
I didn't need it.
I disagree. I can't have you eating anything at the moment in case you choke. Oxygen stats are 88%. 88%. 88%. 88%. Heart rate is 71. I saw oxygen start crashing. Alright, sweetie. So, you're going to be going into a seizure very shortly. Hey Google, set timer, 10 minutes.
Build timer for 10 minutes. Starting now.
Sorry, oxygen concentrate applied at 4:04. Seizure behaviour commencing. Oxygen stats are 88%. Throughput increased to level 3. Seizure 4:05. Heart rate's increased 95 and increasing further. Doing okay. Oxygen's at 89. Hey Google, stop. That's a 5-minute timer on the nitrolingual spray, GTN spray. Once she's got cognizance, I'll check with her what her standing is for chest pain. Medical oxygen concentrated on level 3 throughput. Oxygen stats are 94 and improving. Hey gorgeous. That was very sudden onset, 4:06 p.m. You can see the risk around obviously just eating just prior. She wanted some chocolate. Now, there was a high precedence level of risk of having seizures today. Dyan does have a genetic chromosomal condition, 22q11.2 deletion syndrome. High incidence of having seizures with this condition. Further seizures occurring now. 4:06. Okay. Also has hypermobility, hence why I'm supporting certain joints at the moment so that she doesn't dislocate or sublux. It's alright. It's okay. It's alright. The chromosomal condition 22q does have a high incident rate. 65% of patients with this condition will have seizures and seizure-like condition. 8.3% will have epilepsy specifically. Dyan has multiple ranges of different styles of seizures, all under this condition, including also dystonia. Also orthostatic intolerance to POTS, which will have effect on heart rate and also oxygen flow, oxygen saturation. At risk of obviously aspiration and choking. Now, Dyan's actually hit the catalyst of all the key contributors that can contribute towards further tonic-clonic seizures happening and occurring right now. Left postural inversion of the left foot at the moment as well, part of a sigmatic cranial dystonia, I'd imagine, or focalized dystonia. Okay. Alarms aren't going off, so we're in threshold at the moment. So I'll set a 10-minute timer to start off with when the seizures commence, so that I can apply midazolam, which I'm now just getting ready anyway because the seizures are continuing without break. Oxygen stats at 94%, throughput is at level 3, heart rate is at 60, so we've had a drop after that. So key contributors while we're having seizures today specifically. Temperature, 32 degrees, it was hitting in Perth, so a very, very warm day. Temperature always affects her with her inability to regulate, thermodysregulate. Lack of sleep. Sleep is the biggest contributor for sleep seizures related neurologically, and a lot of participants with 22q have sleep disorders with that condition as well. Dyan has autistic ADHD, OCD, and has Tourette's, as well as all the other things. There are about 185 clinical symptoms that you can possibly see in patients with 22q, and Dyan has got a lot of those classically from birth, but with late diagnosis. She's presented thousands of times at hospitals over the years. No, I've been there, but it took only 2 years ago, after a lot of work, to get a genetic diagnosis for 22q, which actually answered 100% of every single separate condition and all the separate under diagnoses that she had. You're doing okay. Current time's 4:09 p.m. So, lack of sleep. She didn't get to sleep until 3 a.m. this morning. Okay, sweetie. She was up late in correspondence to that. We've adjusted medications accordingly, so her medication levels have been kept up to date and appropriate. She's had stress. Dealing with the NJS, the disability and the health systems always cause stress. So that hasn't been a good thing. She's been running fevers, 37.8 up to 38 degrees, so she's in that febrile range. Febrile and infections are the two key contributors towards a lot of participants triggering into seizures, and she's always got that. So she's been running 38 on average temperatures for the last 3 months straight. She's had multiple infections that we've been dealing with a range of different antibiotics, and I think she's got an eye infection currently at the moment as well. Hence why we've got some eye antibiotics from the pharmacy today. A lot of things to deal with. Hey, sweet pea. 4 minutes 20 on the countdown timer. Oxygen stat levels have come up to 3. I'm reducing the throughput to a level 2 on the oxygen concentrator. Heart rate is at 62. It is 4:10 p.m. We are Monday, 3rd of November. Oxygen stats at 96, we're on a level 2 throughput. Heart rate is at 64. Temperature, like I said, is 97.7. I need to bring that down once I'm able to. Once she's able to swallow, I'll give her some liquid Panadol Osteo. Just going to take her blood pressure. She'll be able to hear me, not probably able to communicate very well during this phase. There's been a lot of Tourette's, particularly a lot of Tourette's late last night and then into this morning. So Tourette's are always an early indicator too in the predominant and preictal phases of seizures. Part of a neurological presentation for Dyan is when Tourette's ramps up, both vocalization, coprolalia, eculalia, but also the motor tics have been very significant today. Current room temperature is great. It's 23.8 degrees. We try and maintain that spot on for this, but like I said, Dyan is running warm. She should have taken the Panadol, but she chose not to herself. I was out at the time.
Right.
It's alright, gorgeous. I'm right here. Alright, blood pressure reading is high for Dyan. So let's have a quick little chat about that and why it's high and why is that more of a concern. 117/70. Now it's in that range, heart rate 71. Yes, nitrolingual spray is going to increase that with the chest. Now that you're coming around and able to communicate a bit more for me, is your chest pain still there, sweetie? Okay, great. I don't need to give a second dose of nitrolingual spray. Dyan's baseline, looking at 85/60, and heart rate should be 50 to 52 beats per minute on average in the supine lying down position. Obviously, it's quite elevated and heightened for her. The vascular constriction of a GTN spray will increase both of those readings somewhat, but obviously having seizures will increase that somewhat as well. You're doing really well. Oxygen stats are at 96. Heart rate is at 70. Neck on the angle is most likely an axial tilt dystonia. There's some blepharospasm seen in the face at the moment. 1 minute left on the 10-minute seizure countdown timer. So we run that to see if seizures will naturally self-terminate by themselves. If they do, then hallelujah, great, well done. If they don't, then that's when I'll step into providing ASMs, anti-seizure medications, as part of our flowchart, the next steps in the process. I need to get her some Panadol, I need to get her some muscle relaxants as soon as she's able to swallow. Very, very hot to touch in the peripherals. Okay, gorgeous. You know who's here?
Yeah.
Okay, do you know what day it is? Third of November, could guess. Yeah, it's Monday today. Alright, no worries. You're doing really well. Oxygen stats are 95%, heart rate is at 62. No more chest pain? Yeah, November 3. Good girl. Timer is about to come down on the seizure detection, so we probably won't be applying the midazolam unless she goes into further tonic-clonic seizures at this stage. We use Google Home Automation to maintain this. Hey Google, stop timer. Got one other timer running. That's actually my lunch, believe it or not, of all things, which I've got in the oven. Well, lunch come dinner, it's 4 o'clock, 4:14 actually, and I'm trying to have an early dinner. Our timetable has been really out of whack. It was a very autistic night last night, and I had great struggles trying to get to sleep. Okay, seizure indicators are coming through right now. That's the first of them. These are the indications that I look for as termination, self-termination of seizures for Dyan in the tonic-clonic state and type. She'll probably have 3, 4, maybe even up to 5 quite deep, lengthy yawns. That's great. If we see those, then we know that we're needing to apply the midazolam. I'm actually replacing the midazolam away now, but the time is gone and she hasn't still got those happening. Syncope, pre-syncope can still be happening. Fatigue, post a seizure can still be happening right now. 97% on the oxygen, 63 on the heart rate. Okay, you know I'm here, don't you? Just checking reflex and responses. Hey, sweet bee. You're very, very warm. I need to give you some liquid Panadol, and I'm going to do that now.
Yeah.
Checking dosage level. Right. Let's just find a syringe.
Someone's burning.
What's burning, boo boo?
Really fever.
Okie dokie. We're going to be doing a liquid Panadol. We're going to do this in 2 stages. I'm going to give you 5 mils. We start low, go slow. Setting up, because of dysphagia, the ability to swallow at this phase. Alright, coming in, pressing in, and squeezing. Good go. Just wiping on the outside. Doing okay there? Oxygen stats are at 93% at the moment. Heart rate is at 72, increasing throughput to 3.
Great. Great.
Okay, coming in with a drink. Good girl, you're doing really, really well. We'll be giving you some more medications in a moment.
Oh.
Oh no, you don't, but that's what's happening. Do you have any nausea?
No.
Okay, let's pop in this in. Good girl. Let's try and keep that one in your mouth for me. Okay, so 4:18 p.m. I have just applied medicinal CBD THC 1010, a 0.5 ml combination, which will help with seizures, pain, relaxation, nausea. It's a good overall combination medication that does all of those things at once. I've also given 5 mils of a Panamax 240 elixir. Now it's half the adult dosage for the moment, but I'll increase that as I see the need. Temperature is just at 24. We're going to actually bring the temperature in a different way. Okay, we've got the fan directly on down, so we have a fan just down here. We also have up the top here air conditioning that we can control and adjust suitably for Dyan. So both of those in operation. Generalized dystonia, the chorea. So this leg action at the moment is actually part of generalized dystonia. Chorea is rhythmical dance-like movements of the legs. And it comes from the Greek word choreography into dance, and that's why you're having dystonia. I need to give you a muscle relaxant as soon as I'm able to see that you can swallow properly. Oxygen stats are 94%, heart rate is elevated, 79, 80 and climbing. Sweetie, I can take you down. Gabby, might need just to hop out the way for the moment. Sorry, Gabs. You can sit with the cherry ripes over there. It is 4:20. We have 2 minutes on my lunch, counting down. But we have to turn the oven off so that we don't burn that. I'm going to do that right now. Turn the oven off a couple of minutes prematurely. And the oven door open so I don't burn the nut. I'll come back to lunch later once everything's stabilised. Right, oxygen stats at the moment are flapping 97, 96. I'm going to bring the throughput down here, just down to 2. Heart rate's already dropped off nicely, 56, 57, just around that range, which is good. Let's have a look at her face and what's happening over here. Dyan's really not all that cold as it still, are you? You're struggling a little bit. Alright. We've got a temperature, so we're going to bring the temperature down. You've got no nausea. Now, as I was saying, I was talking about what are some of the early indicators and why is this happening for Dyan today. Dyan does have quite regular seizures, some different things can trigger off. But post-seizure Tourette's is also very common. So we're out of the tonic-clonic stage, but in this phase, this is why I need to get the muscle relaxing into her. So I'm going to give her a clonazepam very, very shortly, to be honest. Let's see if that can help. Now, she's had the very poor sleep, didn't get to bed until 3 o'clock in the morning, late arousal, poor quality. She's had temperatures, so increased temperature range. I've got the gauges over here. I'm going to turn the fan off. It's okay, I need to bring the temperature down. Temperature's been high, fevers, have been there. So infections quite likely, like I said, eye infection at the moment is the latest version, so we've got some antibiotics to work on with that side. Now bowel medications, Dyan has got gastroparesis, a dysmotility of the GI tract, part of the condition, quite commonly seen in patients with 22q as well. So she's on a lot of bowel medications to try and get things through. Day 2, every time. Day 2, by the time we're in the medication for the bowel medication, it trips over the electrolyte imbalance for Dyan. Even though she has got electrolytes as a drink, which is consistently taking, we have a whole range of supplements and other medications that we provide daily to try and compensate. Hey Google, stop. However, it is always day 2 and it's a guarantee, to be honest, that seizures will occur. And when you combine all of those other indicators, the risk factors, it becomes a high level likelihood of that actually happening by the end of the day. And because during the end of the day, the fatigue's also increased. She's got PEM, post-exertional malaise. You trying to do like a Halloween thing going on here? It looks like one of those walking zombies. You do that very well. You should be in like The Walking Dead. You do actually pretty well in that movie, TV series. Let's not even go there. All right, I think she's got some cognizance coming around, but there's a lot of ticky, jumpy happening. I need to give you, and there's another one of the yawns. We're looking for those. Thank goodness. Bring on the yawns.
I just watch TV now.
Oh, can you just watch TV? Yeah, that'll be nice. I'm going to give you some clonazepam, which you need to
Why
swallow.
is my bed wobbly?
Oxygen stats are 94%, heart rate is 63, a little bit more elevated than I'd like it to be for what we're doing.
Why did my bed wobble?
I don't know, honey bunny. I really don't. Now I'm going to increase this up a little bit. We're going to place this in front.
Pillow and stuff.
I'm going to bring your pillow into play now. Good
Why
girl.
did you take it away?
Right, pop that in for me, please.
What is
There's clonazepam, 2 milligrams.
Why? It's only got...
No, your tics aren't sweetie. They're going to keep going at the moment, and we'll get some more dystonia happening. You've got that as well. So, thank you. Good girl. It is 4:23. Not giving 2 milligrams. Are you going to be like that? Are you finished playing with it? It's like you're playing with your food. Swallow it. It'll melt on your tongue. And it'll be yucky, and you won't like that. It'll be a sensory nightmare. God. The pathological demand avoidance, it's a real thing for Dyan as an autistic around medication. Really? Want me to take the drink away from you now? Or have you finished with it? You're a little shit. She's a little shit. I'm allowed to say that. I'm her husband of 34 years and I know her very well. She's a little shit. Right. You're back with me, but you're going to be a little bit more ticky still. It's 4:24. Did you feel anything with those seizures coming on? Tell me what you felt. Have you had any pre-ictals, particularly whilst I was away today? Did you have any goosebump indicators on your left leg? Any water running sensation down the side of your head? Did you have any nausea? Have you had any previous chest pain? Were you having any difficulties walking backwards and forwards to the toilet with gait issues, tripping, ataxia? Third of the yawns, you'll notice that it's stifled, but again deep yawn, and that's good indications that the seizure side of things is over. Other neurological events can still happen around that, before, during and after, oftentimes simultaneously. What can you remember for me? Spacing, aphasia, difficulties with speech, finding words, tripping over, stuttering or slurring, ticky, Tourette, coprolalia.
I couldn't do a video again for the 500th time because I kept forgetting what I was talking about throughout the whole thing.
Okay, so inability to be able to focus, concentrate, get through a task, and actually talk. Okay, so you had difficulties with that. Okay, no walking issues?
Bit spacey maybe.
Bit spacey. Any little glimpses of forgetting time which would indicate absence? Oh, here we go. What? What did you forget to tell me?
When you got back.
Yes, when I got back. What happened when I got back?
Flashlights.
Okay, in your peripheral?
Yeah.
Left side, both sides, bilateral, left side. Okay. Everything seems to be very left orientated for you.
And I thought, seizure. And then I went, no.
Oh, so this is an internal conversation you had in your head.
So I just
but you
pretended
didn't. You pretended it didn't happen,
point
and you
where
didn't tell me.
I forgot.
You forgot. This is what I'm
Mine
living
don't
with.
matter.
It does matter. Yeah. This is
Stressful.
why all the allied health
My
professionals, medical professionals, Dyan cannot be left unsupervised. She has to be monitored 24/7, supported with her independence and activities, but monitored from a health perspective. She can go into these events very quickly.
I would rather like to call it monitored because they're stupid.
Yeah, I agree with that as well. No issues on that one. However, these risks can just jump up and happen very, very quickly. And Dyan, with being autistic, has great abilities in communicating with interoception. First of all, the internal states of awareness. Am I hot? Am I cold? Am I having seizure-like symptoms? Oh, should I tell anybody?
I did feel panicked, remember?
Right, yeah, you had some distress.
Well, I thought it was about what we were watching.
Right.
But in hindsight, maybe I was a little bit more...
Yep. Okay, heightened.
Because, the dread.
Yes, the dread, absolutely. And that's, you can have the Alice in Wonderland sort of trippy sensation.
Yeah, it depends.
Or you could have an absolute dread. You can even be
It's one or
crying.
the other.
Seconds to minutes just
Laughing
before
or
going
crying.
into that.
I've laughed
Wow,
as
you've
well.
laughed. It's like, what the hell are you laughing at? It must have been a good joke.
And then boom.
And boom, and it hits you, absolutely, as well. Now, you didn't bite anything inside your mouth, tongue, cheeks, lips.
I can't feel.
You can't feel them. Just have a quick look if you don't mind. Quite commonly, Dyan will. Just because you have a seizure and clonic seizures doesn't mean that you're always going to. It's about 35% of patients actually will bite inside of lung, lips, tongue, or cheek. So it doesn't happen to everybody. Let's have a quick look. No worries. That one on the left-hand side is healing up from the seizure you had the other day, which is really good. No teeth dislodgement, no teeth cracking. You've done really well.
It's in alignment.
Everything's in alignment, so the jaw's not out. You haven't had much segmented cranial dystonia. You really went bam straight into tonic-clonic seizures. That was very interesting. Normally, again, predictably, we'll get a build-up. We'll get certain activities, perhaps some nausea, might have a headache.
When? How long ago?
20 minutes ago.
Wow.
So you went straight into...
I've got a lot of pain here, but this...
that'll be your
neck.
CCI, cranial
It's a
cervical instability.
permanent-
Yep.
It's permanently, you just kick them.
Okay.
You
I'm
just
sorry for kicking you.
kick
My
them to the
apologies.
side.
I just
You
went...
just,
Yeah, well,
I'm
normally it's a
so
cat that's
sorry.
surfing on this.
Like he just went. Woof.
Right, I'm going to actually give you an ice pack
Hello,
first.
kitty.
Cat, put your kitty down.
Hello, kid. That's rude.
Catch.
That's not what I meant.
Right,
She goes here.
right, she does. Well, she had to hop out of the way.
This goes.
Oxygen starts at 91%. Can you not talk for 2 minutes, please? I'm bringing throughput up to level 3. Really? You're a shit at the best of times. Right, we'll keep
They
this.
caught it.
Well done for catching it. Now, your oxygen status is low. Don't talk. Right, watch her, supervise her, because if you don't, who else is going to? I have to go and get...
Oh my goodness! Can you stop with this?
Oh no, it's a bit of a...
forward driving.
It's a bit forward driving.
The tripod. Forward driving the tripod. That's not acceptable, is it? Unless you're Superman.
Right, we do have the surgical pack hot clay. These are clay packs that are very flexible. They do go inside the T-tabs.
Steak knives with that.
Why do you get steak knives? You've lost the plot. You're tethered at the moment, so I wouldn't go off book around. Head back there, thank you. Oh my god. Head back.
And you get steak knives.
Oxygen starts at 94. Shh. Breathe. Not laugh, you
I
flip.
can't help it.
I don't need cataplexy right now. Can you stop? Take 3 deep breaths in now. Oh god. And her oxygen goes offline. Can you not? Shit me. Dyan does have cataplexy. Emotional cataplexy where you're around laughter and suddenly she'll just stop breathing. A lot of her family just pass out, fall over on the ground. Yeah, it's a real thing. That's why she's also a high risk of narcolepsy. She's actually got 5 out of the 6 indicators for narcolepsy, which is also a risk with patients with 22q as well, interestingly. Right, breathing's back up, 94%. Great. Heart rate,
Yes,
66. I'm going to pick you in a moment. You're giving me the shits. Have we finished now? It is 4:31. It
Can I
is Monday,
read?
the 3rd of November. It is
Those cute
29
little.
degrees
What
outside
are
at the
those
moment.
cute little
Nutcrackers?
Nutcrackers.
Right, darling, your body doesn't have the energy to do this right now, so let's actually give it a pause. Alright, you have this little plastic tubey thing trying to give you oxygen. Far out. Right, you want some Benton? Yes or no? Yawns. Do you need Ventolin?
No.
Nope. Do you have any chest pain?
Freezing. Yeah, no
It's
chest
freezing. It's
pain.
not freezing.
It's freezing.
Try 2.1. It's cold. Right.
Cold.
I'm going to bring that temperature up a degree. I'm going to turn it off just for the moment. Deal?
That one's on.
Yep, that's good.
So I'm cold.
Okay. Would you like a blankie?
I'm fine.
All right, princess. Have a princess.
I am not a princess. They are.
You are a princess.
No.
Absolutely. Right,
A
oxygen stats.
princess would not have bad health.
98. We're going to drop you down one, and if you can stay sustained, I'll be able to take this off in a moment.
Can we take it off now?
No,
Why?
because your oxygen is flapping
Is that
everywhere.
why my arms full a bit pins and needly?
Yeah, right.
It's weird from down from
That's
all the way
funny
down.
about that. It's trying to get oxygen to the main organs that it needs to work in. Can you stop doing that? Okay, as you can see, the deep yawns are coming in thick and fast.
No.
Yes, so we know already that the seizure component self-terminated just under
No.
10 minutes. Hallelujah, thank goodness, great. The Tourette actions will be reduced even further. There'll still be a little bit of flicking going on, but that's where the clonazepam will come in. Honey, you don't have the oxygen for that. Which part of don't talk, don't sing do you not understand? She is the worst patient ever. Gosh. How's the ice going? Not making you extra ticky?
Tell me at ease.
Oh, I don't know if I want to say that. At ease, soldier. Right, other checks. Do you have any headaches? No. Your feet are operational and moving properly? Great. 10 to 15% of tonic-clonic seizures for Dyan can actually end up in Todd's paresis as paralysis bilaterally, both sides, evenly, though a little bit more left-dominated. Paralysis of the feet, lower legs, even upper legs. Sometimes it can even translate into the upper limbs as well, full body paralysis. It's temporary, it can go for a half an hour, it can go up to 16 hours. Luckily in this case. This is actually normal behaviour for her, so no, it's not actually something weird. She's just a performer and a character at the best of times. Yes. Oxygen stats 97%. It is. Alright, we're going to take you off oxygen.
Yes.
I'm going to do that,
Winner,
because
winner,
otherwise
chicken dinner.
you'll end up choking yourself.
I did it.
Well done, you.
Oh, what happened?
Yeah, okay, well, you know what happened.
I
Or
don't.
You don't.
Little-
What were the
little bit.
predictors that would tell us, hey...
Nothing. There was no predictors.
Oh, for God's sake.
I was watching a police video. They were chasing the
They
allegedly
still are,
bad man.
allegedly.
Allegedly.
In Queensland.
It's starting to become a lot allegedly.
Anyway, your
I've got more to say, but I'll get into
predictors...
trouble.
Yes, your predictors were very rare. Sleep,
I didn't
3
get enough
o'clock,
sleep.
poor quality.
Whoops.
Fever, 37.8 degrees.
Well, that's,
Infection,
kind of high.
eyes.
Yeah, I've got 2 infections
Stress,
now that we know
NDIS
of.
and health systems dealing with.
Yes, people that
And
just...
the primary one,
It's just day after day. It's
Day
it's
2,
something to
3,
fix
bowel
it.
bowel
Bob
medications.
the builder.
All right.
Can you fix it?
Okay,
Bob
relax your
the
arms.
builder. I'm gonna
Relax.
fix it all.
Relax your arms, princess.
What else?
So the bowel medications, you
Oh,
know,
yeah, that always
always.
Malabsorption.
Yep, and it changes your electrolyte balance.
No,
Right.
no. It stops the sodium
And
valproate
it also changes your
from
electrolyte
getting
balance
into my
particularly.
body.
Now, that would have also affected your potassium levels, which is why you're feeling more angina. The potassium, she takes the potassium supplement Span K every day to help with
For
that.
my
That has
arrhythmia.
dramatically reduced the arrhythmias, which is great, but there's still some in tachycardia motion that actually occurs that we see. Why are you
Swim
swimming?
with the whales.
Okay, ma'am. Now, remember, anything you see in these episodes are pertaining specifically and only to Dyan. We're not here to
Gotcha.
diagnose or give you management
Gotcha.
clinical care because
Gotcha.
we're not medical professionals and that's not
Gotcha.
our job to do that. So please go and see your own doctor, primary care physician or a specialist. That's Dyan's Tourette's and it's really annoying. At least I'm not seeing Chewbacca's wife.
Ooh, that's a good one.
Yeah, it is. Well
That
done.
happens at shower time.
It's a spontaneous shower time thing.
Why?
That's
Why is it a shower
a good question.
connection? That one.
That is a good question.
Although it has been out of the shower, but
Yeah.
seems to be.
There is a correlation to that, with some action that you do.
Maybe
Right.
it's the shaving.
Oxygen stats off, oxygen concentrator is 95%, heart rate is 66 and stable.
I don't know, guys. Complex Tourette's is fascinating.
It is actually.
If
It's
you
amazing
know
what
more
draws
about it
upon.
than me, please let me know, because I don't know anything. I just have it. Okay. What is that noise? The oven.
That's the oven dispensing its heat because I have got food in there that I need to get out.
Go get your food.
I need to go get my food out. 2 moments.
Max.
He's gallivanting around somewhere. He's actually in his
Maxie.
tower. So we've got
Sleep.
Willow over there.
Where's his sleep?
Maximus is actually in here in his tower out the front of our door,
Oh, Max.
keeping an eye on you from a distance, or actually just slacking off as usual.
He's slacking off.
Now, no talking, I'm just taking a blood pressure reading, and I'm about to have my lunch, which is over there as well. Levels have improved somewhat. We've got 95% oxygen, 56% heart rate at the moment, 56 beats per minute. This end of the yawns. Let's just see what we've got. All right, so blood pressure has come down.
Ouch.
So it's now 99/60. It's on its way on downhill. Heart rate is 55 beats. Thank you, ma'am.
Take it off.
Bit sensory overloaded on that one, are we?
No more.
No more. Now, overall, you've got through it. Well done. It's 4:40 p.m. Hallelujah.
Time for sleep.
Yes. Now you can actually have a cherry ripe if you actually felt like one.
Oh, I feel like I didn't choose for my dinner, so I guess no.
Okay, then we can get you some dinner
Doesn't feel
organised.
right. Yeah, after your dinner, I'll have my dinner.
Sounds good to me.
Whatever
Alrighty.
that is going to be, I don't know yet.
Well, you got a nice salad which I've made up
Ooh,
fresh,
yummy.
actually. So a garden salad with some cheese. That's the goal. These episodes can come on very, very quickly. They can also resolve pretty quickly as we follow the procedures and the processes that are around. If there's ever a life-threatening risk for non-suicide, escalate, get an ambulance here, and get Dyan out straight away to an ED. But we've been managing these for quite a few years, so we are quite well versed and have most of the equipment that we need. Although we still need some. We do need a defibrillator ASAP, and we are working on getting a permanent oxygen concentration and oxygen cylinder solution with the NDIS National Disability Insurance Scheme. That's something which we are working on. Thanks very much for sticking around. Big thumbs up of encouragement. Hype the channel, which does help us gain visibility.
Thanks,
Comments,
guys.
questions, ideas, and suggestions,
Sorry.
leave them below. Don't say sorry,
This
not your
is
fault.
not my videos that I...
Want to do, like to do, but
yeah,
it
these
is
aren't but
what we
this
share.
is- if you don't know my whole story, you don't know me.
Exactly. This is what we have to deal with, and it is
This
part
is
of the
our
education
real
and
life.
advocacy of rare, complex conditions as we talk about. Don't forget to subscribe, hit that notification bell, and we'll see you in another episode real soon. Bye for now.
Bye.